Right, so we are looking at the next scan right here before us. This is what is known as a fetal anomaly scan. Fetal anomaly scan. So of course, anomaly is something that is not normal. Alright, so they don't say fetal abnormal. No. There's a way they actually coin medical terminologies, so that when two medical personnel are communicating, even if it is something that is about to kill a patient, the tension around that place will be calmed down. Do you understand? So for the anomaly scan, is also known as what? 20-week ultrasound. All right, it's also known as what? Anatomy scan. It's also known as what? Level 2 ultrasound. So many names. So it's a detailed prenatal imaging. That's when the baby is still in the stomach. You are doing this type of imaging. The baby is still in the stomach. So it's typically done when the woman has reached 18 weeks of pregnancy, 22 weeks of pregnancy. So its primary purpose is to assess the development of the fetus and dictate if the baby has any structural abnormality, all right, or if the baby will be born with what? Any disease condition from the stomach. Some babies are born, they are paralyzed. Some babies are born, there's issue, the head is looking one kind. So you want to pick up all of this in this scan even before you give birth to the baby. So purpose is you want to look at what? The shape of the baby. That's the fetal anatomy. Look at the brain. You want to observe the heart. You want to observe the spine. You want to observe the kidneys. You want to observe the limbs. You want to look at the face. You want to look at what? The abdominal organs. Okay, observe everything. All right. So placenta, you want to look at how the placenta is positioned and structured, because placenta is very vital to the baby. That's where nutrients actually reach the baby. Okay, blood circulation too. Amniotic fluid, you want to see, that's the environment where the baby is inside. You want to see that the baby is swimming very fine in their swimming pool. All right, umbilical cord, how it is inserted, cervix and uterus. All right, you want to check for if there's any issue that will come when the baby wants to be giving birth. All right, so it helps to confirm gestational age of the baby, check how the baby is growing, dictate if you are carrying a twin or just one baby, identify markers for chromosomal abnormalities. Basically, you want to check out for any possible abnormalities. Okay, so what to expect during the scan? All right, so it's conducted using 2D ultrasound. All right, 2D. Though 3D may be used for further evaluation needed, but a normal one is just 2D. You see it like this only. Okay, so a transducer is moved over your abdomen. This is a transducer, ultrasound transducer. This one that the woman is holding, they're moving it on your stomach. So this scan usually takes 30 to 45 minutes. So most hospitals, they will tell you that they can attend to only 8 patients in a day, 12 patients in a day. Yeah, this is because one person takes this long. So you may be asked to have a partially full bladder to improve image clarity. In most cases, you can also find out the baby's sex if you want. So conditions, it can dictate if the baby maybe has spinal bifida, cleft. This one is medical now. Is any disease, structural issues on the body, cleft lip, cleft palate, heart defects, if there's problems with the kidney, problems with the leg, problems with brain development, problems with abdomen wall, and all of those. So what happens if abnormalities is found? A repeat scan or more detailed imaging like fetal echocardiography will be done. You may be referred to a maternal fetal medicine specialist. Like they can even start treating your baby even as the baby is still in the stomach. Okay, so they can also do amniocentesis, where they actually extract some amniotic fluid right there from the stomach, just to basically do further testing. So that's just it for fetal anomaly scan.